Drop it.
Pregnancy. That is the way we are all brought into this world. It's also very easy to totally mess up, but follow this simple guide and you'll be all good. Alright, let's go. While a woman is pregnant, certain foods that are usually no big deal to eat can be harmful to the developing fetus. Foods such as raw fish, not fully cooked eggs, and not fully cooked meat can be harmful due to salmonella. Tuna and other fish that are high in mercury. Unwashed vegetables and unpasteurized milk due to harmful bacteria that are all upon it. Processed foods such as what is on screen right now is due to unnecessary calorie intake that can lead to diabetes. Caffeine because it leads to stunted growth.
Beer.
And such alcoholic beverages can lead to stillborns and miscarriages, and can also impact brain development, so just avoid it. Drugs should be avoided because it too can lead to miscarriages and premature labor. It can also increase the risk of placental abruption, cutting off the nutrients and air to the fetus, ultimately killing it. And now, here's a quick rundown of some individual drugs.
Marijuana. Marijuana crosses the placenta to your baby. Marijuana, like cigarette smoke, contains toxins that keep your baby from getting the proper supply of oxygen that he or she needs to grow. Studies of marijuana in pregnancy are inconclusive, because many women who smoke marijuana also use tobacco and alcohol. Smoking marijuana increases the levels of carbon monoxide and carbon dioxide in the blood, which reduces the oxygen supply to the baby. Smoking marijuana during pregnancy can increase the chance of miscarriage, low birth weight, premature births, developmental delays, and behavioral and learning problems. Cocaine. Cocaine crosses the placenta and enters your baby's circulation. The elimination of cocaine is slower in a fetus than in an adult. This means that cocaine remains in the baby's body much longer than it does in your body. According to the Organization of Teratology Information Services, OTIS, during the early months of pregnancy, cocaine exposure may increase the risk of miscarriage. Later in pregnancy, cocaine use can cause placental abruption, which can lead to severe bleeding, preterm birth, and fetal death. Otis also states that the risk of birth defects appears to be greater when the mother has used cocaine frequently during pregnancy. According to the American Congress of Obstetricians and Gynecology, ACOG, women who use cocaine during their pregnancy have a 25% increased chance of premature labor. Babies born to mothers who use cocaine throughout their pregnancy may also have a smaller head and be growth restricted. Babies who are exposed to cocaine later in pregnancy may be born dependent and suffer from withdrawal symptoms such as tremors, sleeplessness, muscle spasms, and feeding difficulties. Some experts believe that learning difficulties may result as the child gets older. Defects of the genitals, kidneys, and brain are also possible. Heroin. Heroin is a very addictive drug that crosses the placenta to the baby. Because this drug is so addictive, the unborn baby can become dependent on the drug. Using heroin during pregnancy increases the chance of premature birth, low birth weight, breathing difficulties, low blood sugar, hypoglycemia, bleeding within the brain, intracranial hemorrhage, and infant death. Babies can also be born addicted to heroin and can suffer from withdrawal symptoms. Withdrawal symptoms include irritability, convulsions, diarrhea, fever, sleep abnormalities, and joint stiffness. Mothers who inject narcotics are more susceptible to HIV, which can be passed to their unborn children. Methamphetamine. Methamphetamine is chemically related to amphetamine, which causes the heart rate of the mother and baby to increase. Taking meth during pregnancy can result in problems similar to those seen with the use of cocaine in pregnancy. The use of speed can cause the baby to get less oxygen, which can lead to low birth weight. Meth can also increase the likelihood of premature labor, miscarriage, and placental abruption. Babies can be born addicted to meth and suffer withdrawal symptoms that include tremors, sleeplessness, muscle spasms, and feeding difficulties. Some experts believe that learning difficulties may result as the child gets older.
Sleeping in a certain position while pregnant can harm both the fetus and mother. For example, the proper way to sleep while pregnant is on the mother's left side, as not to crush the baby as sleeping on her stomach would, or crushing the mother's liver like sleeping on the right side would, or crush the mother's vena cava if sleeping on her back in the second or third trimester. Pressure on the fetus, well, this one's obvious. The fetus is growing within a woman, so she isn't going to enter a belly flop competition, because that would crush the baby. Radioactivity. This one is also obvious, as the effect of radioactivity in grown humans would also be prevalent in developing fetuses. Avoid X-rays and Chernobyl during pregnancies to avoid this one.
sunshine for everyone, but as far as